Hello, I'm Dr. Craig Escude. Welcome to Medical Monday. Today we're talking about behaviors and how they might indicate underlying medical conditions. So today we're going to talk about urinary tract infections and the behaviors that you might see in people who aren't able to verbally tell you what they're feeling. So what are the symptoms of a urinary tract infection? Usually it is a feeling that you have to go to the bathroom often. You might have burning when you urinate. Those are really the big common things that you see. So in a person who can't tell you that they're having those symptoms, what you might see is that they might be getting up and down frequently. They might be going back and forth to the bathroom a whole lot. They might also resist going to the bathroom because they know that every time they go to the bathroom and they urinate, it's going to hurt. So they may not want to do that anymore. The person might also reach down to the area of discomfort. So they might reach down to their genital area. And that could be, again, like, we said before, if you bump your elbow or something, you're going to kind of hold it and reach for it. So they might do that because that's the area that it's hurting. They might also reach their lower stomach area because of bladder discomfort or bladder pain. They could also guard their stomach, rock back and forth as well, too. In a person who's incontinent, and what that means is that they can't control their urine, let's say they use an adult brief and they urinate in an adult brief, what you might see is every time they urinate, they scream, they become agitated, they become aggressive. And it might be hard to correlate those things because you're not actually able to see what's happening. So if you see someone in an adult brief and they just have these really unusual episodes of discomfort, check and see if they've urinated at that time. And that could mean that they might need a medical evaluation to look for an underlying urinary tract infection. So, think about all of those things. Remember that people who don't communicate with words still communicate, and they may be communicating what's going on through behaviors. So remember that. Thanks for joining us today, and we'll see you again soon. Many of the topics that you hear on Medical Mondays comes from the book Clinical Pearls in IDD Healthcare. It's a great resource guide that provides helpful clinical information to anyone who provides support for people with intellectual and developmental disabilities. This includes family members, direct support professionals, nurses, physicians, and others who work in the field. You can find it at replacingrisk.com. That's replacingrisk.com in our store.